was asked to talk to you today about some of the protective measures we're making at the hospital and in general about the corona outbreak. First step would be for our greeters and to determine which patients were potentially COVID positive or be persons under investigation. So you would approach the greeting station. They would provide you with a mask, and they would have masks on as well. They would first take your temperature, and if you did not have a temperature, then they would ask the questions whether or not you've had shortness of breath, cough, fever at home, had exposure to COVID positive or potential COVID positive, or someone who's under investigation, or have you been asked to quarantine? Once those questions are all answered in the negative, you would be, this time, directly brought back to a bed. The sterilization or cleaning of the emergency department and the patient rooms is something that we obviously take very seriously. There are different levels of cleaning and different processes we use. The first would be for the negative pressure rooms, which are the rooms that are set aside for known COVID, high-risk aerosolized processes such as emphysema, asthma, that we might need to use aerosolized products. Once the patient is either admitted to the hospital or discharged, the room is left vacant for 30 to 60 minutes to allow the airborne particles to settle. Then the environmental crew will go in and wipe down every surface with Virex to eradicate the virus. The likelihood of contracting COVID or coronavirus in the hospital is minimal. The steps that we take to keep the patient separated that may or may not have COVID or COVID symptoms from the patients that do not have COVID symptoms is something we take very seriously. The likelihood of contracting in the hospital versus being out in the general public, not everyone is masked. And then in the general public, not everyone is necessarily on high alert as far as their hygiene. One of the biggest fears that the medical community has is that patients aren't necessarily ignoring their symptoms, but they downplay the symptoms, or they're too afraid to come to the emergency department to be seen. Their doctor's offices are not open. The restaurants are closed. There's a stay-at-home order. And so I think a lot of these patients potentially suffer at home as opposed to seeking medical treatment. The staff and what they do to protect themselves is very similar to what you'd see and recommend for the general public. Good hand hygiene, washing for 20 seconds at a time with soap, not touching your face. Further, in the emergency department setting, is they're all wearing masks to cover their face and their nose. And also, the nurses that do see patients that have the potential for COVID or a person under investigation would wear full protective equipment, would be an N95 mask, a shield, protective gowns, gloves, shoe covers, and in some cases, hat and hair covers. The steps that a patient could take when coming to the emergency department to try and keep themselves safe would be the same steps that you'd recommend for being out of the general public. You'd be a good hygiene, washing your hands, not touching your face. Along with that would be to mask. But if you didn't have a mask, that should not keep you from coming to the emergency department, because we would be able to provide one for you. The other thing for immunocompromised patients is many times they have a close relationship with either primary care physician or specialist, given their underlying medical problems. So contacting the person on call to maybe talk through the emergency department visit would be always a good idea. Certainly not if you felt you had an emergency that couldn't wait. I would bypass that.